Good evening. I'm Hartford Healthcare's Tina Verona. We're so glad you can join us this evening. I am here with Dr. Godfrey Pearlson. He is the director of the Olin Neuropsychiatry Research Center right here at Hartford Hospital. And we're going to be talking about a fascinating study that we're about to embark on here at Hartford Hospital. It's in collaboration with the Metabolic and Bariatric Surgery Center, also here at Hartford Hospital. Dr. Pearlson, it's always a pleasure to have you. Thank you so much. It's always fascinating to talk to you. So
You're
really
welcome.
excited about this study. And you've been collaborating with the bariatric surgeons here at Hartford Hospital for about 8 years now. And what have you learned since this collaboration has sort of taken place about weight loss and the brain?
So that's a great question. Contrary to what most people think, it's very hard to predict who will do well following weight loss surgery. And as more and more people in the developed world are becoming obese, bariatric surgery is a realistic option for people who cannot lose weight in other ways, and additionally have health problems such as type 2 diabetes or severe arthritis, and have failed conventional programs. So you may think just sensibly that following surgery, if your stomach is the size of a golf ball, it all comes down to plumbing, so that everyone would lose weight and everyone would be a success. And in fact, there's considerable variability. People are ingenious. Some individuals will melt a gallon of ice cream in their microwave and drink it slowly through a straw and not exercise and sit on the couch. And unsurprisingly, they will not lose weight. And it's impossible to predict prior to surgery exactly who those people are. So we thought, since the brain talks to the gut, if we teamed up with the Bariatric Surgery Center, Drs. Tischler and Papasavas, we'd be able to be better at predicting.
Now, you had just received grant and funding from the National Institute of Diabetes, Digestive and Kidney Disorders to conduct a study. So this is sort of almost like part 2 of a pilot study that was already done on 65 participants to look at neuroimaging, MRI scans, and how the brain communicates with the stomach in terms of having successful weight loss surgical outcomes. What did you learn from that initial study? And then we'll get into the study that you're going to be embarking on now over a much longer period of time. So let's talk about the pilot study first.
Absolutely. So we looked at 65 individuals prior to their bariatric surgery, and we recorded all the things that people had previously said are unhelpful. So anxiety and depression levels, what sort of diets they were on, what success they'd had, hormone levels in their blood, and so on. And confirmed that none of those things were good predictors, as other people had said. But partially to our surprise, we found that what their brains did in the MRI scanner predicted over half of their weight loss a year following surgery.
Wow.
And there was a variety of tasks that these people underwent in the scanner. Being exposed to food cues, having little squirts of milkshake in their mouth, trying hard either to feel very positive about food or very negative, like the food was not going to be good for them and they didn't need extra calories.
Right, right.
And based on people's brain fingerprints, if you want to call them that, and just the patterns of activation in the scanner, we found that we could predict for individuals very clearly who was going to do well and who wasn't.
And yeah, and this is sort of not really pardon the pun, one size fits all, really, for people. I mean, everybody's individual and it's different for everybody, but you have a pretty good idea of which type of person, given these indicators, can do better in the long run. Is that right? Yeah,
that's exactly right. And the way we want to use this is to help with people's long-term course prior to their surgery. If we can predict for a certain individual they're not likely to lose a whole lot of weight following bariatric surgery, we can immediately tell them that. So you're not going to lose a lot of weight with the surgery, therefore we'll enroll you immediately afterwards in a carefully supervised diet program, or we will give you medications that will help you lose weight in addition to the surgery, so that everyone hopefully will be more likely to be a long-term success.
Now, this was looking at a group of 65 people over the course of 1 year, correct?
Right.
Okay. Now, this new study that you're going to be embarking on, which you received the funding for, this is a 5-year study looking at about 150 people?
Yes, and those 150 include the 65 that we originally looked at.
got
So
it.
we'll be able to look at them really over the long term.
Were you surprised by the initial findings that you saw among the 65 participants at all?
There have been little hints from tiny studies in the past, and this was the first chance that we had to do this on a larger scale in more people. But it pretty much conformed with what we'd hypothesized, that you can think of various areas in the brain as like a gas pedal and a brake, things pushing you towards rewarding stimuli or enabling you to stop and put brakes on things. And when we looked at the gas pedal and brake regions, that was critical in figuring out who was going to be successful with weight loss.
Sure, absolutely. We're talking with Dr. Godfrey Pearlson. He's the director of the Olin Neuropsychiatry Research Center right here at Hartford Hospital. We're talking about a new study looking at neuroimaging predictors and how that can influence successful surgical weight loss outcomes in the future for patients. We actually have a question from Marcy. She wants to know if this study is new. She had her surgery on February 27th, 2017.
So we collected data over the past 5 or so years. Not sure if Marcy, if you were in our study, but we're starting to enroll for our new study within the next couple of months. So if you're interested, that's certainly something that we can offer people like Marcy in the future.
So let's kind of delve into, for folks like Marcy out there, what the study entails. And we're talking about neuroimaging, we're talking about MRI scans.
Right.
What can someone expect from the study?
So we would take a very detailed history prior to the person undergoing bariatric surgery. We'd want to know about their diet and exercise patterns, their previous attempts to lose weight. We want to measure their exercise tolerance, how fast and how far they can walk. And we're interested in some hormonal measures. But most of all, we're interested in getting people inside of our scanner and exposing them to various kinds of tasks to see how they react to food cues. And those food cues could be actual little tastes of things like milkshake, or they can be pictures of food, sometimes when a dietitian is watching them, or sometimes playing games that are like bidding on eBay to look at people's responses to rewards and punishments.
And you actually, and what's fascinating is you probably see the activity in the brain when you're injecting, maybe say the dietitian is watching you, or when you're injecting these variables, right?
Right, exactly. So the signal you get in the brain from each one of those little stimuli is tiny. But if you add them up over the course of an experiment, you may have hundreds of little spikes in the brain. And you can get a big signal out of that.
And I was going to say, that could give you a pretty big picture, right, of success in terms of weight loss surgery, and what are some of the triggers that can be positive or negative.
Right. That's exactly right. So we're looking for patterns over many of these tests in multiple brain regions and putting it all together.
So what have you found in terms of how the brain actually, how does the brain communicate with the stomach? What happens? Is it thoughts that we have, or is it something when we see something we're stimulated? How does that communication happen?
Well, some of that communication is physical. So there are nerves like the vagus nerve that runs from the stomach all the way up to the brain. So it's sort of a major highway for neural connections. But there are also hormones. So that there are hormones like leptin and ghrelin that are secreted by the gut and travel to the brain and change behavior. And then finally, there's a microbiome, so that surgery changes the pattern of bacteria in your gut. And those bacteria themselves release hormones and release chemicals that communicate with the brain and change thinking. So there's a whole variety of ways that the brain talks to the gut.
Yeah, it's so interesting. And what about if you're, like myself, if I see a dessert, I may not be inclined to eat the whole dessert. I may want to eat the whole dessert, but I tell myself, well, if I just have a bite of that dessert, I'll feel satisfied and not feel guilty. Does that have any effect on what happens in the stomach and calorie counting and that kind of thing?
Yeah, yes,
Weight
it
gain?
does. If you can do that successfully, which many people cannot. Yeah, you and
Doesn't
me
always
both.
work.
Then that sort of strategy is what we're looking for. Are there brain regions that constitute a break that can interrupt the behavior? So when
Right.
people say with chips, you can't have just one, some people
Right.
really can have just one, and it's people who can think in that way that seem to do successfully.
Yeah. Are you surprised at what you saw sort of in this round one, phase one of this pilot study with these 65 participants? Are you surprised at any of all on the findings that you've seen or that you've concluded from that study?
Well, we weren't surprised because other people have found exactly the same thing, that hormones and levels of depression and anxiety and eating patterns and how well you've done on diets don't predict. But we were surprised that brain patterns predicted as much as over 55% of the weight loss outcome at 1 year. We were surprised at just how big that effect was. We were thinking a much smaller percentage. So we were very gratified to find that our brain patterns predicted as much as they did.
Yeah, and how is it that in some folks where, you know, maybe they are taking that little taste of that high caloric milkshake versus somebody who didn't may not gain weight or vice versa? How does that happen, and how does it affect people differently? Is it genetics play a role in that? Is it your history? How does that differ?
Yeah, we believe that it's all of those things acting in very complicated ways that still need to be unraveled. It's not, this is a part of the story rather than the whole story.
Yeah.
But since we can predict over 50% of outcome, we think we've got a handle on a big piece of the story.
Now, are you looking at folks pre-surgery and post-surgery, or just post-surgery? How does that work?
Well, in the initial pilot study, we looked at people prior to surgery and then a year following surgery. And we've yet to analyze the follow-up data at a year. But in the new funded study from NIH, we'll be able to look at people annually for up to 5 years after their surgery.
up
So
to- right.
yeah, it's long-term outcome we're particularly interested in.
And would that be having a scan every year?
Yeah, exactly.
Once a year, and you would I would expect would see changes.
Yes, we already know that we see changes. We've just not fully analyzed those data to know exactly in which direction.
And 5 years out versus 1 year would definitely give you a really good picture of success rates following surgery.
Yeah, we think so, because things can change after a year.
Sure. Yeah, and then we've seen in weight loss surgery, a lot of people will gain the weight back and will need surgery again, or will have to go through surgery again. And this is a tremendous indicator to say the first time around can be successful.
Yeah, and the proportions of people who gain weight back and don't have successful surgeries varies from center to center. The Bariatric Metabolic Center here is usually pretty good compared to other centers with their success rates. But, you know, as we've said, not everyone does well.
Yeah, and you've been collaborating with the bariatric surgeons, Dr. Darren Tischler and Dr. Pavlos Papasavas, for almost about 8 years now. And it's a really unique collaboration, and it's really a collaboration that makes perfect sense.
It is, and both of those physicians are very psychologically minded. You might think of surgeons as people who are all about plumbing and not thinking about the brain.
Right.
But the surgeons here are great to collaborate with because they are so psychologically minded, willing to countenance brain factors and interested in looking at them.
Well, and yeah, because I think the brain plays such a huge role in this, in how we control our eating habits. You know, I think that just plays such a huge role. It's not just about having the weight loss surgery, but your brain has so much to do with how you control yourself after that.
Right, and how you behave after the surgery, how much you can stick to the new diet and healthy eating and exercise. So motivation is kind of a key factor. Part of what we're measuring with the brain imaging, I think, is motivation.
Yeah, and then once you have that data, then how do you teach somebody to sort of redirect your brain, or sort of rewire your brain into thinking differently than it's so used to thinking?
So that's a different kind of study, and we've not yet tried that. But one of the tests that we developed is something that we collaborated with a scientist at Yale called Hedy Kober. And Hetty has a regulation of craving task that she's used in people previously who want to quit smoking or to give up cocaine use. And she too measures these brake and gas pedal regions, and they can be trained. So what you're saying is perfectly sensible. I think even some people are exploring feedback in the scanner, so that even as you're looking at stimuli, you can train your brain to react less.
Right.
Or more to healthy stimuli. And that would be interesting future studies.
I was going to say, I'd like to see that one. That could be phase 3, right?
Yes, right.
After this one.
Yeah.
We'll get through this one first. What about just some of the folks to say, hey, you know, I've had weight loss surgery. My stomach is the size of a peanut now. How is it possible that I can gain weight?
So people are ingenious. So we've seen patients who will melt a gallon of ice cream in their microwave, drink it very, very slowly through a straw. And if you do that, you can take in a surprising number of calories, albeit very slowly.
Oh, I will note that. I will try that tonight.
Yeah, don't try this at home.
Yeah, don't try this at home. So it's fascinating, and also, and we've seen with weight loss surgery, people with metabolic issues right after surgery, those disappear. The diabetes, the high blood pressure.
Right. So that was a surprise to metabolic surgeons and people who study these patients, that after bariatric surgery, even in a few weeks out, before people have lost significant amounts of weight, their type 2 diabetes will normalize, or their blood pressure will start coming back to healthy levels. But particularly with diabetes and other metabolic problems. So clearly something's happening at a metabolic level that's not just related to the weight loss. So that's fascinating too.
Right, that is totally, well, the whole thing I find is so fascinating, and we're going to have you back to see how this study is going going along in terms of how you're going to be embarking on that soon. So we're going to have you back to give us an update on that. Dr. Pearlson, it's always a pleasure to talk to you, and it's always so fascinating.
You're
so
welcome. Thanks so much for having me.
And thank you for joining us tonight, Dr. Godfrey Pearlson from the Olin Neuropsychiatry Research Center here at Hartford Hospital. I'm Hartford Healthcare's Tina Verona. We'll see you soon.
Thanks, Tina.